Good morning everyone. My name is John Gribisi Penales and I'm assigned to tackle reproductive health, contraception, and explain the benefits and risks of each form of contraceptives. But before I start, what is contraceptives? It is defined as the use of various devices, sexual practices, chemicals, drugs, or surgical procedures to prevent conception. Male condom, it prevents sperm from entering a woman's body. It is suitable for persons of all ages. It is available without a prescription and does not require a prior medical evaluation. It is most effective method for providing contraception and STI disease protection. Good morning everyone. My name is John Gribisi Penales and I'm assigned to tackle reproductive health, contraception, and explain the benefits and risks of each form of contraceptives. But before I start, what is contraceptives? It is defined as the use of various devices, sexual practices, chemicals, drugs, or surgical procedures to prevent conception. Diaphragm. A diaphragm is a type of birth control that uses a barrier. It prevents pregnancy when used in conjunction with spermicide by blocking the uterine opening and preventing sperm from moving and fertilizing an egg. The cervix is covered by a shallow, dome-shaped rim cup placed in the vaginal canal. It is 94% effective in preventing unintended pregnancy when used correctly. Contraceptive sponge. The sponge is used to avoid becoming pregnant. A sponge is referred to as barrier method because it separates sperm and eggs. A spermicide is also present in the sponge, which kills or prevents sperm from moving. The sponge is inserted into your vagina canal. You have protection for up to 24 hours after inserting the sponge. After sex, you must leave the sponge in the place for 6 hours. It should not be left in for more than 30 hours. Oral contraception pills. A combination pill combines estrogen and progesterone. Daily oral dose for women. The tablet suppresses egg release and affects tubal motility. An exam will prescribe it. It's 99% effective when taken frequently. It's a simple, practical procedure controlled by the lady that doesn't interfere with romance. Vaginal ring. The ring, unlike the pill, continues to work even if you are sick, vomiting, or diarrhea. Premenstrual symptoms may be relieved and bleeding will likely be lighter and less painful. More vaginal discharge, breast tenderness, and headaches are all temporary side effects for some women. Skin patch. Because the stomach doesn't absorb the hormones from the patch, it still works if you are sick, vomit, or have diarrhea. It can help you have more regular, lighter, and pain-free periods. It can alleviate premenstrual symptoms while also lowering the risk of ovarian, womb, and bowel cancer because it does not protect you against STIs and can cause skin irritation, itching, and soreness. You may need to use condoms. Injectables. This work by increasing the viscosity of cervical secretions, which act as a sperm barrier, pretending ovulation. Combinable injectable contraceptives are types of hormonal birth control used by women. They consist of monthly injections of combined estrogen and progesterone Formulations to avoid pregnancy. Intrauterine devices o IUDs. A skilled medical practitioner insert a small flexible plastic device, usually copper, into the womb. After menstruation, abortion, or 4 to 6 weeks after delivery, the fertilized egg is not allowed to enter the womb. Copper ions are spermicidal inhibitors. It's 95 to 98% successful, doesn't interfere with the lovemaking, and can be removed if you don't want to get pregnant. Contraceptive implant. The birth control implant is a highly effective form of contraception that is easy to fit and remove and is long-lasting. Using a birth control implant does come with a few risks, such as infection and changes to the menstrual cycle, and it does not protect against STIs or HIV. Male sterilization or vasectomy. A guy may choose to undergo a vasectomy if he does not want to father more children. It is long-term or permanent male contraception. Two tubes termed the vas deferens are cut and sealed during surgery. The vas deferens transports sperm from the testicles to the urethra, necessitating inpatient care. It does not affect health or sexual vigor, and it does not interfere with intercourse, contrary to popular perception. Female sterilization o tubectomy. The fallopian tubes are severed and the ends are tied to prevent the sperm from meeting the eggs, and this permanent surgical procedure. It is a highly safe treatment that only requires 1 day of hospitalization and may be done at any time, ideally after the delivery of the previous child. Spermicide. Spermicide is about 70% effective in preventing pregnancy. When used alone, it's one of the less effective birth control methods. If you want to avoid getting pregnant, you should use it with another form of birth control, such as a condom or a diaphragm. Its effectiveness in preventing pregnancy will improve as a result of this. It is not effective in preventing sexually transmitted infections or STIs. Vaginal pH regulator gel. Pixie is used during a sexual act. Each act of sex with Pixie can last up to an hour. No daily schedule is needed because not every woman wants birth control while not having sex. Vulvovaginal burning sensation, pruritus, mycotic infection, urinary tract infection, discomfort, bacterial vaginosis, vaginal discharge, genital discomfort, dysuria, and pain were the most common side effects, 22%. Fertility awareness methods. Use one or more indicators to predict the days in a woman's menstrual cycle when fertile or when an ovum has been released from the ovary and is ready to be fertilized. Fertility awareness-based methods either predict when ovulation will happen or show when ovulation has already occurred. These techniques are most effective when a woman's regular and predictable menstrual cycle. Coitus interruptus. Coitus interruptus is a traditional method of family planning. Before ejaculating, the man removes his penis from the vagina and away from the female partner's external genitalia. There are no direct risks associated with using the withdrawal method to avoid pregnancy. It does not, however, protect against sexual transmitted infections.